Hi, this is Jacob Avila of 5 Minute Sono, and today we're going to learn how to use ultrasound to look for appendicitis. Your probe of choice for this examination is going to be the curvilinear or the linear probe. I personally prefer the linear probe, and I think most people do because it gives you the highest resolution image. However, the depth of the linear probe might not be what you need in some of your patients that are a little more obese, in which case a curvilinear probe can be useful. As far as where to put the probe on the patient, I always start by asking the patient to show me exactly where it hurts. I say show me with one finger exactly where your belly hurts. They put it there and I stick the transducer in that same exact area. Every time that I found appendicitis, this is how I found it. I'll put the probe where it hurts and I'll move up and down a couple of centimeters and see if I can see an appendix there. Another trick that can be useful is to have the patient place their right leg over the left leg. This theoretically can bring the appendix a little closer to the anterior abdominal wall. If you ask the patient to point where it hurts and you put the transducer there but you don't find the appendix, there are a couple of other ways that you can look for it. The main landmarks are going to be the iliac crest, the iliac artery, and the psoas muscle. So I'll identify the iliac crest over here, and then I'll try and find the iliac artery and go up and down the iliac artery because oftentimes the appendix is just going to be sitting right on top of the iliac artery. Now if that doesn't work, I'll go ahead and just lawnmower, just go up and down the entire right upper quadrant because the appendix, even though it should be at that classic McBurney's point, sometimes isn't, so you kind of have to look for it sometimes. So here are the landmarks that I was talking about. Over there on the left side of the screen in green, you'll see the iliac crest. If you go medial, you'll see in red the iliac artery and then the psoas muscle in blue. Those are kind of your big landmarks. The psoas muscle is going to be the most posterior aspect of the box that the appendix should be in. The iliac artery is going to be the most medial aspect, and the iliac crest is going to be the most lateral aspect. Right here, see this kind of lumpy, bumpy shadow right here? This is colon, and I'll talk about why that's important later. Now here, I'm going down the iliac artery, and right there I see a tubular structure that is not peristalsing. That is a normal appendix. Once you've found the appendix, it's a good idea to measure it. I mean, that's one of the main ways that you see if it's appendicitis or not. So what I do is look for it in long axis and then turn it to short axis right there, and then you can measure it, the anterior posterior diameter. Notice that when we look at it here, the anterior posterior diameter is a little bit smaller than the lateral diameter over here. In a normal appendix, you might see this. In a normal appendix, it's going to be compressible. But if you have a patient that has appendicitis, measuring it anterior, posterior, or lateral doesn't really matter as much because it's going to be a nice circular structure. Now, if you've done all of your tricks and you still can't find a normal or abnormal appendix, then you're going to have to go and look for it. You'll want to find the transition between the cecum and the ileum. The appendix is, of course, going to be a blind-ended pouch coming off of the cecum. The cecum, which is the large intestine, is going to show a gas pattern that typically is lumpy, bumpy like we see here. So instead of there being a nice straight line with A lines below it, kind of like how you see in a lung, you see this irregular line with some dirty shadowing underneath. This is thought to be what the large bowel looks like. And this is small bowel over here. So you'll see some bowel peristalsing with some particulate matter inside of it. Also, you might see an air pattern that's a little more like what the lung looks like. So you'll see a nice white hyperechoic line with a few A lines below it. I'll be honest, this transition between the two is very difficult to find, and I actually have a hard time finding it. But if you really need to figure this out and you don't have access to a radiology performed ultrasound or a CT scanner, this might be an option for you. So let's get into exactly how to diagnose an appendicitis. Your two main criteria are going to be a non-compressible tubular structure that is greater than 6 millimeters. A couple of other minor criteria is a ring of fire. That is when you put color Doppler and there's increased flow around that circular tubular structure, and surrounding edema. So this is a classic picture of what an appendicitis looks like. We have a tubular structure here. There's the wall of the appendix with some edema around it. You can see the edema right there. And then right here, you actually get to see a fecalith. Sometimes when you have the patient point to the area where it hurts, you're not going to necessarily see that appendix on first glance, but you might see some clues. Here we have the anterior abdominal wall here with some free fluid outside of the bowel. That clued us in that there was some abnormal. We looked a couple of centimeters more distally and found this nice appendix here. Sometimes you're going to get to these patients a little bit later. This is a patient that had a ruptured appendicitis. You can see a small tubular structure right about there, right there, and all this is surrounding edema from that rupture. It's probably just a contained abscess on this patient. Don't forget that your ultrasound examination is very specific but not sensitive. So if you see an appendicitis, the patient probably has it. But if you don't see it, it doesn't necessarily mean that they don't have it. Start by asking the patient where it hurts and put your transducer right in that area. That's where I've had the most success. If that doesn't work, you might need to go up and down the iliac artery or just lawnmower that whole right side of the abdomen. That's it for this week's 5 Minute Sono. If you have any questions or comments, please feel free to send me a tweet or email me. And don't forget to subscribe. Go to blog.5minutesono.com/subscribe, put your name and email address in the text box, and never miss another video.